Start madam. Hello, ma'am.
Hello.
Shall we start the session, ma'am?
Okay.
सोने डब्बी में क्या है बेटा? इसमें पैसे तो ना रखे तुम्हें?
किसने?
उठा के लेके उस डब्बी को।
Hello. YouTube connect नहीं हो गया। इधर करो। नहीं तो
Good morning, madam.
Good morning, sir.
Shall we start, madam?
Yes, sir. Am I audible?
Yes, madam. Yes.
Yes.
Hello and good morning to all the participants. Today we are having Dr. Deepthi Bhagavadekar, madam, Associate Professor, Department of Panchakarma, KLE Sri BMK Avidyalaya, Belgaum, Karnataka. Welcome, madam, on behalf of my department and the participants to this national webinar on Panchakarma, Panchajanya 2020.
Thank you, sir. Thank you.
Yes. Today, madam is going to present us with basics of exercises therapy. Basics of exercise therapy. Madam has in the past, madam has presented basics of electrotherapy, which was very innovative and it is very knowledgeable also, and we have experienced all the electrotherapic methods. Today, we want to know from you, madam, in different muscular and neurological diseases, which type of exercise therapy is going to be prescribed. This we want to know in detail, madam, from you.
Yes, sir.
Yes. And for the participants who are having any queries, please post in the chat box. And this program is live on Zoom as well as YouTube, and the recorded version is also available. And lastly, I once again welcome you, madam, for this webinar series on Panchakarma.
Thank you.
And I hand over to Dr. Radha for a brief introduction of today's guest speaker, Dr. Deepthi Bhagavadi. Thank you, madam. Thank you.
Thank you, sir.
Namaste, ma'am. Good morning to all. Myself, Dr. Radha from first year PG scholar from Panchakarma department. It is my pleasure to introduce today's eminent speaker, Dr. Deepthi Bhagavadi, ma'am. Ma'am is presently working as Associate Professor of Department of Panchakarma in KLE Shri DM Kankanwadi Ayurveda Mahavidyalaya, Belgaum. Ma'am has completed Bachelor of Physiotherapy in KLE Institute of Physiotherapy in the year of 2007. Ma'am has completed Masters of Physiotherapy in the KLE University, Belgaum in the year of 2009. Ma'am has teaching experience of 10 years of UGs and 7 years for PG. Ma'am has done research specialization in musculoskeletal disorders and pediatric physiotherapy. Ma'am has published many research projects. Some among them are development of evidence-based medicine for Katigraha, a retrospective analysis, and the development of evidence-based medicine for obesity, introspective analysis. We are honored to have you, ma'am. Today, ma'am is going to deal with topic basics of exercise therapy. Before we start the session, some instruction to the participant. Please mute your audio and video while joining the webinar. And if you have any doubts, put it in chat box. If any network connection problem is there, please wait patiently until the resume of network. Thank you, ma'am. I request ma'am proceed the session.
Thank you so much, Dr. Radha, for your brief introduction. I also thank the principal of your college, Dr. K.C. Das, sir. Am I audible? Hello?
It's audible, ma'am.
Dr. K.C. Das, sir, the organizing committee member, Dr. Badrinath, and even my student, Dr. Supriya Bosle. Before I start, I would like to take this opportunity to thank the principal of our own college, Dr. B.S. Prasad, sir, who has always given us support and always given us opportunities to work in this field. He always likes to work in integrated approaches. So we have done a number of studies, research work, and we have tried to put up protocols in different type of conditions. So I like to thank Sir Dr. B.S. Prasad, sir, our principal, and all my department colleagues and other colleagues in my college and my dear students. Okay, I'll start this session. Shall I start the session?
Yes, ma'am.
This is the second session which we are taking, which is on exercise therapy. Now, exercises or exercise therapy, therapeutic exercises, they are being practiced since ages. Now, as you can see in this picture, you all can see the slides. Can the slides be?
Yes, ma'am. Yes, ma'am.
Okay, thank you. So as you can see this picture, exercise therapy is being practiced, or doing exercises or maintaining the physical fitness or maintaining the health of the particular individual in different conditions is being done through exercises since ages. Okay, now we'll go through briefly how exercises help us and what are the different type of exercises which are practiced in a daily routine. Okay, coming to the introduction, therapeutic exercises, they involve the movement prescribed to correct impairments, restore muscular and skeletal functions, and or maintain a state of well-being. Okay, what therapeutic exercise does is it helps in correcting the impairment. So whatever impairments are there, let it be any condition wherein deformities are there, or there is pain, or there are any other impairments, they are being corrected by exercise therapy. They restore the muscular and skeletal function. So whatever joint and muscle functions are there, like let it be flexion, extension, or sitting, standing, these are all are being restored, or they are being re-functional through exercise therapy. Okay, and thus it maintains a state of well-being in the individuals. So when the body is healthy, obviously the mental status of the individual will always be healthy. So it gives a state of well-being, right? Further, as we saw in the last class also, what is rehabilitation? It is is again, and habilitation is behavior or skills. So getting the skills or getting the techniques, getting the behaviors again into our life is called as rehabilitation, or restoring the functions again is called as rehabilitation. Okay. Now, what does a physiotherapist does when a particular patient or an individual comes to you with particular condition or impairment or any problem? First is to give proper examination. Okay. When any patient comes to us or any individual comes to us, you have to examine the. Okay, we have to examine the individual. Now, what type of problem they are having, we have to give the consultation. We have to tell the patient how to prevent the worsening or how to prevent the problems further. We have to give the interventions to solve that particular problems or that particular condition. We have to give education to the patient. That is very important, giving education on what has to be done, what has not to be done, like the do's and don'ts. Okay, what type of exercises should be done, what type of lifestyle should be maintained further. That is very important. Then we have to tell them about the research or the recent updates, or we have to tell them what will be more beneficial to them. So, like that, we can build up the evidences also in the practice. Okay, so examination, consultation, prevention, intervention, education, and research. All these should be done, will be done by a physiotherapist when any individual or patient approaches the physiotherapist. Okay, now these are the some of the common physical impairments. There may be many more also. I have tried to highlight a few. One is the pain. So pain is a basic important ailment wherein the physical exercises play an important role. To reduce pain, it has a very important role. Physical activities or physical exercises, they release endorphins. Now these endorphins, they are good hormones which help in reduction of pain. So always doing exercises to a certain extent will reduce pain. Then in muscle weakness. Okay, so wherever weakness is there in any particular joint or in any particular muscles nearby the joints and in any particular muscles, for example, flexor group of muscles or extensor group of muscles. Okay, when that weakness is there, we have to go for strengthening or resisted exercises. Next, when there is decreased muscle endurance, okay, whenever muscle endurance is decreased, that is the capacity or capability of the muscle to do a particular exercise or to do a particular activity, it is decreased. That time we have to go for exercises. Then limited range of motion, of course, after maybe like post-fracture stiffness is there or frozen shoulder is there, when rheumatoid arthritis is there and they are having limited range of motion and those particular joints which are affected, that time we can go for exercises. Then when joint hypermobility is there, so wherever joints are hypermobile or hyperextended, we can go for exercise to maintain the stability of the particular joint. Otherwise, doing the daily activities is difficult. Then in case of faulty postures, like for example, exaggerated kyphosis is there or exaggerated scoliosis, that is where the lordosis is increased or decreased. Okay, so wherever the normal curvatures are being affected, okay, then that time when the patient or the individual starts taking faulty posture or due to pain, if the patient is pain. Yeah.
Slides are not changing, ma'am.
Pardon?
Slides are not changing, ma'am. Only one slide is seen, ma'am.
Only one slide. I am able to see the slides. इधर नहीं है मोशन. Now you can see the slide.
Yes, ma'am. Thank you.
Has the slide changed?
Yes, ma'am.
So it is the common impairments which you are seeing.
Common physical impairments.
Yes.
Slides there.
Now, can you see the other slide, starting position?
Ma'am? Hello,
Now,
ma'am?
you can see the slide, it has changed.
Yes, ma'am.
I'll get back. Okay, till now it was clear.
Yes, ma'am.
Okay. So in common physical impairments, we saw how these are the different impairments wherein exercise therapy can be done. That is what we were discussing. So first one was pain, then the muscular weakness, then muscle endurance, limitation of range of motion, joint hypermobility, and faulty postures. Till here we were done. So wherever faulty postures are there, like as I mentioned, kyphosis is there, scoliosis is there, or hyperextension is there, etc. Or faulty postures can be taken due to pain. Okay, so if sciatica is there unilateral, the patient starts bending on the other side. Okay, so these type of faulty postures can be treated with the help of exercise therapy. Next, muscle tightness. So when they are many of us, even in the normal routine, we find muscle tightness is there. Especially in cold season, we have neck tightness, muscle tightness, or even normally many individuals. I myself have hamstring tightness. Okay, so we all can't bend forward and touch the toes without bending the knees. Okay, so like that, different types of tightness are there, which again hamper. If they are severe tightness, they do hamper in the daily activities. So those will be treated with the help of exercise therapy. Then balance problem. Patients like any problem?
No, ma'am.
Okay, I'll continue. Slide is seen. Na?
Okay, ma'am. Yes, ma'am.
Balance problem. Okay, whenever balance problem is there in cases of Parkinson's, or in cases where stroke has occurred, post stroke balance problem might be there. Okay, so those are again very well treated with the help of physical therapy exercises. Then in coordination, we all have learned there are a lot of incoordination problems, that it be upper limb or lower limb. There has to be proper coordination for our daily living activities to take place. So those in coordination problems are being taken care and treated with the help of physical therapy exercises. Then delayed milestones. As last time we discussed that in cerebral palsy, where delayed milestones are there, or only in delayed milestones cases, physical therapy is a very important therapy. It plays a mainstay of the treatment. Then when there is increased abnormal tone, increase in tone or decrease in tone or dystonic features, all the three conditions do require physiotherapy to a larger extent. Then when there is decreased aerobic capacity, so whenever what is decreased aerobic capacity? Whenever the fitness of any individual is reduced to a certain capacity, that is called as decreased aerobic capacity. So that can be taken care again with physical therapy exercises. Then impaired circulation, where we have conditions like peripheral vascular disorders, varicosities, Burgess disease, Raynaud's disease, or any other cardiac impairments wherein thrombosis is there, or etc. That time where impaired circulation is there or reduced circulation is there, again exercise therapy plays an important role. Fine. These are some of the common ailments which I have mentioned. There are many more also. Okay. Now, there are certain positions in which exercises can be done. They are like standing, then kneeling, side lying, sitting, hanging, or supine or prone lying. Now, this picture you can see that in side lying, the patient is able to do exercises. Okay, now before starting with the exercises, I would just like to put an overview on the muscle strength testing. Now, assessment of the particular group of muscles or the joints is very important. Now, we all know this manual muscle testing gradings. like 0, 1, 2, 3, and 4, and 5. 5 is the normal grade.
Excuse me, ma'am. Again, the slides are not changing, ma'am. Yes, ma'am.
Shall I keep it like that?
Yes, ma'am. Now it's visible. Yes, ma'am. You can continue.
Now you can see. I'll keep it.
Yes, ma'am. Yes, ma'am.
Okay. So manual muscle testing. We all know about this manual muscle testing. Okay, wherein we have 0 as no contraction, 1 as flicker of contraction, 2 as range of motion within the gravity or within gravity elimination. Then 3 is full range of motion against gravity, and 4 is full range of motion against gravity against resistance. 5 is full range of motion against gravity against maximum resistance or normal function. Okay, now this grading is very important. When according to the grading of the muscle, the exercises will differ. Wherein 0 and 1, wherein the patient is not able to do movements at all, the exercises which should be done is with the help of the therapist or with the help of any slings or something like that. Fine. So these exercises are called as passive movements. Okay. Next is 2, wherein against gravity the patient is not able to do the movements. He is able to initiate, but he is not able to complete the movement. Right. In 2 and 3. So that time we will go for active assisted, wherein actively the patient is doing and we are assisting the patient to complete the movement. Okay, then 4 is where the patient is able to do the movements completely. But then now I have to increase the strength so that the muscle function is normal. So when I have to increase the strength, I have to add a particular resistance. Now to add the resistance, I can use weights, dumbbells, weight cuffs, or whatever. Okay, these things we'll see in the further slides now. Am I clear with these gradings and the exercises which can be done? Shall I continue?
Yes, ma'am. Yes, ma'am.
Now you can see the next slide.
Yes, ma'am.
As I said, in grade 0 and grade 1, we will go for passive exercises. So grade 0, grade 1, passive exercises and passive electrical stimulation will be done. So we have to do the movements for the particular patient. So passive range of, what are passive range of motion exercises? Okay, they consist of stretching, immobile muscles and joint capsules to prevent joint stiffness and muscle contracture. Okay, so wherever joint stiffness are there, for example, bedridden patients, let it be any condition, when they are bedridden and the movements are not occurring at that particular joints or at all the joints. Okay, if we don't move the joints or move the muscles, okay, the patient will be likely to go into joint stiffness and muscle contracture. Okay, so to prevent that joint stiffness and muscle contraction, we should go passively into the exercise, like how you can see over here, passive exercises are being done by the therapist. Okay, like that exercises should be done. Here you can see wherein the physical therapist is trying to hold the arm and then move it into flexion. Okay, so this patient is not able to do actively. Whenever the patient is not able to do actively, the physical therapist helps the patient to do it passively, and these are called as passive range of motion exercises. Basically, as we mentioned earlier, it is for maintaining the joint mobility and to prevent the muscle wasting or the muscle contraction. Right? Going to the next slide. After passive exercises are done, when the grade is improved to 1 and 2, okay, we go for active assisted. Right? Is it clear? Slides are seen?
Yes, ma'am.
We go to active assisted. What is active and assisted? Active assisted is when the patient is trying to either initiate or to end the range of motion, but he requires some help, he requires some assistance. So active assisted exercises, they are done by the person and a helper or a therapist, right? They are the exercises which are used when the patient has weak muscles or when the joint pain limits the movements. So for example, in cases of osteoarthritis, where the patient is able to do little movements but not complete the ranges, wherein extension is possible but not completely. So then the physical therapist tries to help her do the movement. So that time actively how much she is able to do, the patient does, and further the physical therapist assists in completing the range of motion. Okay, during active assisted range of motion, it is important to avoid forcing the joints or the soft tissues beyond the point of pain. So whenever pain is there, after that we should not force the joint because of that particular inflammation or because of that particular pathology the patient is not able to complete. Whereas the muscle, if we try to cure the particular pathology or inflammation, the movements will be recovered again. Okay, next, these movements are done by a person who do the exercises all by himself. This is the active movement. Once active assisted phase is gone, we go for the active movements. Okay, patient is come to grade 3 above. Okay, wherein he is trying to eliminate the gravity and go against the gravity. So in active range of motion exercises, the person does the movement by himself. He doesn't take any help by through any physical therapist or through any slings. Okay. Now these are active, wherein she is not taking any help from any other physical therapist. Now comes the resistance. Once you understand that the patient is able to do exercises by himself and he is able to complete the range of motion, you give the you have to improve the strength of the particular muscles, okay, or you have to improve the range of motion of the particular joint. That time you have to apply the resistance. Now that resistance can be through some means, okay. Now resisted exercises, they are done by a person using several modalities such as weights against gravity, elastic bands to increase the muscle strength, okay. So we can use weights, we can use movements against gravity, wherein gravity acts as a resistance. Okay, we can use elastic bands or therapy bands to increase the muscle strength. So it depends on again the condition and the severity. Accordingly, how much weight should be used, what method of weight should be resistance should be used can be decided. Now this is the therabands which are used to apply resistance. This is the manual resistance, wherein manually a physical therapist is trying to give resistance against the range of motion. Like she's trying to do abduction.
Excuse me, ma'am. Ma'am, slide is again not changing, ma'am.
Okay, I do like this one. You can see resisted exercises.
Yes, ma'am.
This is the theraband which are used. These are the therapies which are used for a particular exercise. This is manually when a patient is trying to give, when the physical therapist is trying to apply force, and then patient is trying to do abduction and the physical therapist is trying to give force in the opposite direction. So that gives a manual resistance. Okay. Next, these are the weights which are used. So depending on the condition, I said, like this person wants to do fitness. So depending on the condition, different types of weights also can be used. Then coming to the isometric exercises, static exercises. These are different type of exercises which are helping the patient in their daily living. Okay, this is a form of exercise which is involving the static contraction of a muscle without any visible movement in the angle of the joint. Now, when we are mentioning about static exercises, okay, where static exercise is a contraction, wherein the contraction is visibly seen, but the movement is not occurring at that particular point. Okay, this picture will show you better. Now here, the patient is trying to put pressure on the towel. Okay, so here you can see at the knee joint, you can see a contraction. Okay, but the movement of flexion or extension at the knee joint is not occurring. This is called a static contraction. Okay, this can be done in at different, like static neck exercise, static low back, or static this is called a static quadriceps, wherein the quadriceps muscles are statically, isometrically they are contracting. Then when we keep it under the ankle, then it is called a static hamstrings. Okay, so this is the type of contraction wherein the muscle movement is not occurring. The muscle is not flexing, nor extending, nor adducting or abducting, but the muscle is contracting and relaxing. I hope it is clear. Okay, this is reflected in the name, that is isometric. Means iso means same and metric is distance. That is the length of the muscle doesn't change. The length of the muscle remains the same and the tension in the muscle changes. That is the contraction and relaxation occurs. Okay, this is isometric exercise or static exercise. Next comes static exercise, isometric exercise. They are resistance to isometric contractions can involve maximal contraction of the muscle against the body's own muscle. Okay, so when the muscle is contracting, that is pressing the palms together in front of the body. So when we are doing the namaskara posture, okay, when we are trying to press the palms towards each other, that is called a static contraction. Okay, for example, pushing against a door frame. So when we are trying to push against the door frame, I'm not doing any movement, but the door frame is being pushed. I am trying to contract the muscles, maybe at shoulder, elbow, and wrist. Okay, so but it can also involve holding a joint position against a submaximal contraction, like holding a resistance band in a fixed position. So the positions are not changed. The muscles only contract and relax, and the length of the muscle doesn't change. So that is static exercises or isometric exercises. Next, there is something called as isotonic exercises. Here, the length of the muscle changes, but the tension in the muscle remains the same. Okay, so isotonic contraction is a contraction. Strength does not change, but the joint angle changes. So the length of the muscle, that is contraction and relaxation, occurs at movements occur at that particular joint, but the tension remains the same. Okay, for example, in this figure you can see that in isotonic contraction, the movement will be occurring from extension to flexion. But in isometric contraction, no movement will occur, only a contraction and relaxation will occur at that particular muscle group. Fine. I hope this is clear, the difference between isotonic and isometric. The names itself tell. Isometric means iso is same, metric is length. The length of the muscle doesn't change. In this, the contraction occurs, but the length doesn't change. Isotonic is that iso is same and tone is the tension. Okay, can you all see now the slide?
Yes, ma'am.
Isotonic is where is the iso is same and tonic is the tension. So the tension remains same. That is the dumbbell which he is using. The tension is the same. It doesn't change. Okay, only the length of the muscle, that is the length of the biceps, will change as it does flexion and extension. I hope that is clear. Okay, going to the next. Now, isotonic contraction, wherein the length of the muscle changes, there are two types of again exercises in that. One is concentric and another is eccentric. Now, let us see what is concentric. A concentric contraction is a type of muscle contraction in which the muscles shorten while generating the force. Okay, here the muscle shortens. So when I do a flexion, when the origin and insertion of the muscles, they come towards each other or shortening occurs at that particular muscle, that is called as concentric muscle exercises. Okay, during concentric contraction, a muscle is stimulated to contract according to the sliding filament mechanism, and this occurs throughout the length of the muscle, generating force at the muscular tendinous junction, causing the muscle to shorten and changing the angle of the joint. Okay, as I mentioned earlier, this is the muscle structure. Okay, now here what happens? For example, the previous slide, you can see here when the patient is doing flexion, the shortening occurs of the biceps muscle. Okay, and the lengthening will occur at the triceps behind. Right. So the elbow flexors, that is the biceps, will have a concentric muscle contraction, and the elbow extensors, that is the triceps, will have a eccentric contraction. So this is the difference between concentric and eccentric. So whenever I require particular movements at particular joint, I will try to give a position in such a way that I want concentric contraction or I want eccentric contraction. Right? Okay. For example, concentric contraction of the biceps would cause the arm to bend at the elbow. So that is the concentric contraction. Next, coming to the eccentric contraction, the force opposing the contraction of the muscle is greater than the force produced by the muscle. Here, the opposite, as I mentioned to you, the triceps goes into the eccentric contraction. Okay, rather than working to pull a joint in the direction of the muscle breaks or slows the movement of a joint and lengthens while generating the force. So whenever there is lengthening of the muscle, which muscles are lengthened, those are going to the eccentric contraction. Okay, eccentric contraction featuring a heavy eccentric load can actually support a greater weight. Okay, it also results in greater muscular damage and delayed muscle soreness on the day 2 after training. So there is some whenever training going on, there may be sometimes DOMS which is occurring, but that need not be worried to be taken care of. Okay. Now this picture will show you about the concentric and the eccentric. Fine. This is the isometric, wherein the length of the muscle is not changing. This is the isotonic, concentric and eccentric. Concentric is when biceps is shortening. Is it okay?
Yes, ma'am. You can continue.
Okay. So concentric is when this biceps muscle is shortening. When I'm doing elbow flexion, okay. When biceps muscle is shortening, that time this is called as concentric. In the meanwhile, when this is going in concentric, usually this will be triceps will be going into eccentric. And when I'm doing extension, when the muscle is lengthening, that time this is called as eccentric exercise. Right? I hope it is clear. Concentric and eccentric. Shortening is concentric, wherein it is concentrating at a particular point, and eccentric is lengthening. And isometric is no movement is occurring. Isotonic is movement is occurring. Okay. Next, we'll go to the next group of exercises that are called as flexibility exercises. These improve the mobility of the joints and the soft tissues. So we should maintain the flexibility of the joints and we should maintain the mobility of the muscles. Okay, so for that we do these flexibility exercises. Joint flexibility is achieved by means of steady manual stretching of large group of muscles and joint capsules or with the help of mechanical devices. Okay, so there are many flexibility exercises which are done. For example, even yoga, it is one of the exercises which maintains a lot of flexibility of the body. Okay, so these are important for maintaining the joints, to prevent stiffness at the joint, for maintaining the muscles in a healthy way. Okay, for example, we have to have a good flexibility in the body to do our daily activities. Next group of exercises are the endurance exercises. Now, what are endurance exercises is exercises like aerobics, swimming, walking, jogging, cycling, running. These all are endurance exercises. These exercises, they help in giving the endurance, increasing the endurance, or they help in increasing the capacity or capability of the muscles or the physical body, right? So these are also very important group of exercises. Okay, so like as I mentioned, walking, jogging, dancing, skateboards, jumping, rope jumping, running, okay, games, different games, then hoop twirling, okay, these all like increase the endurance or the cardiovascular endurance, which indirectly helps in the physical fitness of the patient or the individual. Next, coming to the physical fitness. Okay, now what is physical fitness? We have to maintain the strength, we have to maintain the flexibility, and we have to maintain the aerobic capacity. So these three are important terminologies, right? Now, initially we have to, there are some factors which depend on the training, like initial level of fitness. Now, some may be already fit who are trying to do the exercise, increase the fitness. Some may be obese or some may be moderately built or leanly built. Okay, each person's fitness will differ. So when I have to initiate any exercise or training for the individual, what is the level of the fitness of that particular individuals at that particular time when she or he is beginning the training is important. Accordingly, I can plan the further fitness. Next, the intensity at which the patient or the individual has to do the exercises. Intensity is at what level or how much repetitions the patient should do it. Duration, how much time the patient should do it. How much frequency. Frequency is how many times the repetitions should be done. Right? Next, the aerobic capacity. Capacity describes the functional status of the cardiorespiratory system, the hearts, the lungs, and the blood vessels. So, whatever the cardiorespiratory system functional capacity is there, that is being described by the aerobic capacity. It is defined as the maximum volume of oxygen that can be consumed by the one's muscle during exercise. Aerobic is wherein oxygen level increases, and there is something called as anaerobic exercises also, where the oxygen level is not being disturbed. Okay, so aerobic exercises, they help in maintaining the cardiorespiratory performance, like whenever cardiac rehabilitation is given, aerobic exercises are being taught to the patient. Okay, then it is the function both of one's cardiorespiratory performance and the ability of the muscles to extract the oxygen and the fuel delivered to them. Right? Then coming to therapeutic exercises, for example, in case of endocrine conditions like obesity or diabetes, in case of obesity, graded physical training should be given. Now, for an obese individual who is moderately obese or who is overweight, and you know there are different categories in obesity. Okay, there are different categories in obesity, like mild, moderate, and severe. So, in mild cases, what exercises we give or what training we give, and in moderate and severe, they should differ. Okay, because the cardiac capacity or the endurance or the capacity of the muscles will be completely different from mild to moderate and severe. Then coming to diabetes, daily activity level is adjusted to the daily insulin dose. Okay, so here the daily insulin dose will be that, and the food which they intake, that active will be should be adjusted according to the daily activities, so that the insulin breakup occurs properly. Next, coming to the pulmonary conditions. Now, there are a number of pulmonary conditions like pneumonia, chronic bronchitis, bronchiectasis, asthma, emphysema, or respiratory lung diseases, etc. Now, all these will require different types of exercises depending on the condition and severity, like postural drainage exercises, deep breathing exercises, relaxation technique, or stretching at the respiratory muscles. So it depends what type of patient is that, or what is the severity, at what level is the condition of that particular patient, and then how much he'll be able to cope up with the exercises also, that is important. So accordingly, we can plan the treatment for the patient. Next, pregnancy or the gynec and the obstetric. So let it be pregnancy, that is antenatal care or the postnatal care. Let it be surgical patients. Let it be mastectomy. Let it be urinary incontinence. All these require a particular group of exercises. Like it may be prenatal or postnatal exercise, relaxation techniques, pre-operative and post-operative exercises, training to reduce the lymphatic edema drainage, then isometric exercises like the Kegels exercises. So again, these are all are different type of exercises. I'm just trying to briefly go with few of the conditions so that you know that in many conditions exercises can be given. Then coming to the neurological conditions like multiple sclerosis or stroke. Okay, we all know after stroke there will be either spasticity, rigidity, or there will be flaccidity, fine, or hypotonicity. So depending on what type of tone has increased, decreased, or in multiple sclerosis, wherein the strength and the muscle joint stiffness, mobility is decreased, we have to give exercises. So we have to go for PNF, that is proprioceptive neuromuscular facilitation, wherein we are trying to facilitate the neuromuscular structures. Then boba therapy or neurodevelopmental therapy. Now this is a very important therapy, boba therapy, which is again used in cases of even cerebral palsy children to get the developmental milestones easily. Okay, then coming to the training of muscle strength. So as I mentioned earlier, if the grade is 0, 1, 2, 3, 4, they all will require a training to improve their muscle capability. Then balance and coordination will be affected in these patients. So we have to assess first what all is affected. Let it may sometimes it is only the tone, sometimes it is the functions, sometimes it is balance and coordination also, sometimes it is only the strength. So depending on the assessment and what are the complaints of the patient, we have to go accordingly training each and every individual component. Then training and maintenance of the general physical fitness, PNF and physical fitness training. So all these can be done, or depending on the condition, which component is required can be utilized. Next, in Parkinson's or myopathies. In Parkinson's, we know that the flexibility is completely reduced. Whatever rigidity starts occurring at particular joints, especially in the lower limbs or in the upper limbs also, the distal extremities. So that time we have to go for maintaining the flexibility. Even sometimes balance is affected, which can be improved with the help of exercises. Training of physical fitness can be done. Then in myopathies, like muscular dystrophies and all, we have to go for isometric or isotonic group of exercise. Next, in case of rheumatoid arthritis or osteoarthritis, flexibility training can be given, and fitness can be given, aquatic therapy can be given, strengthening can be given. Okay, condition. Fine. Coming to the spine, that is, let it be lumbar or cervical or the thoracic. Spine is related with the n number of conditions, like we have the lumbar lord. We have, yes, is it okay? Shall I continue?
Yes, ma'am. You can continue.
In the spine, we have different conditions like lumbar lordosis or kyphosis, scoliosis. Then we have cervical spondylosis, lumbar spondylosis. Okay, arthropathies are there. Then ankylosing spondylosis are there. So these all conditions we require to maintain the flexibility of the joints, and we require to maintain the muscular structure. So that time we can go for isometric or PNF training for the muscle strength of the muscles that have been weakened should be strengthened. Then the core muscle strengthening should be done. Then the treatment of muscle contracture, which are all muscles have gone into contractures, they should be relaxed. Myofascial release can be done in cases of spasms. Flexibility training, that is stretching to the joints, can be done, or mobilization of the joints can be done. Graded physical fitness training should be done depending on the severity. Next, osteoporosis. There are some benefits which occur in the patients at a particular age when osteoporosis is occurring. So, doing physical exercises, it helps in increasing or reduce. It helps. It gives certain benefits like reduction of bone loss, conservation of remaining bone tissues, improved physical fitness, improved muscle strength, improved reaction time, increased mobility, better sense of balance and coordination, reduced risks of fall, reduce risk of bone fractures caused by falls, and reduced pain. So these all exercises, they help in giving different benefits to the different conditions or different patients. Now, as I mentioned earlier, depending on the patient severity, let it be neurological case, pediatric case, orthopedic case, musculoskeletal condition, or gynec, or physical fitness training only, we need to tailor make the exercise according to each person condition. Some may have even tightness. Some, if a patient comes with low backache to us, it may not only have low backache, which is due to lumbar spondylosis. It may be having a spasm. He may be having spasmodic low backache, or he may be having postural low backache. Okay, so the assessment and the function, the affected muscles, how they are affected, whether they are tight, whether they are like reduced strength is there, or they are weak. Depending on that assessment, you can go for what type of exercises should be given in that particular patient. For example, even as I mentioned, like stroke patient is there. Not all are affected with balance and coordination. Not all are spastic. Some may be flaccid also. Some may be in walking, but their gait is not proper. Some may be bedridden. Okay, so first assessment is important. If they are bedridden, then I have to start from grade 0. Okay, so from grade 0, how to bring them to 1, 2, 3, 4, like that. If they are already at grade 3, when that particular patient has come to you, then how to progress by giving strengthening. Okay, so depending on that patient's severity and in what condition he has come to you, he or she has come to us, depending on that, we have to plan the particular treatment plan and start working or inculcating it. Right? Next, okay, coming to the summary. Therapeutic exercises, they help in maximizing the physical function, movements, performance of daily living, health quality of life, and to prevent and minimize and mitigate the effects of the diseases and the injuries. So as I mentioned, we help in maximizing the physical function. So the physical daily activities which the patient is doing, let it be sitting, let it be standing, walking, running, whatever, we need to maximize that. Movements, they have to be maximized. Like if the flexion is hampered at only 100 degrees, I have to see how it goes into 120 degrees or 130 degrees, depending on how much is the range of that particular joint. Then how the daily living activities are being performed. That is very important, for which we are striving hard. Okay, so if the patient is able to not able to do toilet sitting in the Indian type of toilet, then I have to see how I have to strengthen the quadriceps and the hamstrings so that the squatting position is being obtained properly. Okay, like that, there are different conditions. Then the quality of life, as I mentioned earlier, also the quality of the physical therapist's main aim and objective will be to improve the quality of life. We have different surgeons or different medicine or orthopedicians who will give medicines and who will minimize the condition. The pathology the inflammation is minimized. But after minimizing that or during that condition, when the patient is suffering through that condition, even if it is a simple OA, okay, and the inflammation is reduced after taking the anti-inflammatory medicines, the joint or will be weakened, the muscle will be weakened, stiffness will be there, tightness might be there. Okay, after assessment, when we see these all things will be hampering, maybe in sitting, standing, walking. That's how the gait patterns change, as and how some conditions are there for the particular patient. Okay, so our aim and objective will be main to improve the quality of life, right? Then to prevent, minimize, or mitigate the effects of disease. So now osteoarthritis, he has taken medicines from an orthopedician or from an ayurvedician, and then he's come to physiotherapy. Physiotherapy is being done. Now he is almost 80 to 90% improved. Then I have to see how I have to give him the do's and don'ts to prevent the further worsening of the condition, or to prevent the relapse of the condition. Okay, so these all things should be done. Right? Take home messages. Physical fitness is not only one of the most important keys to a healthy body, but it is also the basis of dynamic and creative and intellectual activity. Okay, I hope I'm clear with it.
Thank you, ma'am. Thank you so much, ma'am. It was a very knowledgeable session, ma'am. Some questions are there, ma'am. Shall we discuss, ma'am?
Yes.
First question from Dr. Rohit. Does physiotherapy work in slip disc and how?
Yes, it works in slip disc. As I mentioned just now, whenever any spinal conditions are there, like we mentioned lumbar spondylosis, spondylitis, or spondyloarthrosis, or something like that, or slip disc bulge, etc., we need to give physiotherapy. Slip disc condition will have either sciatica, or it will have pain in low back only. So when, depending on the condition, if first we have to go for pain relieving, and then we have to improve the strength of the particular muscles. Once strengthening is done, then the relapse of the painful episodes are not there. Okay.
Thank you, ma'am. Next question. Whether neck hump can be corrected by exercise and in how many days it can be corrected?
Neck hump,
Yes, ma'am.
kyphotic neck.
Yes, ma'am.
Okay. Whenever kyphosis is there, actually at the neck, normally lordosis will be present. But then in some postural disorders, kyphosis occurs. Now, when kyphosis is there, if it is at the initial stage, okay, then I can go for exercises. If it is at the later stage, wherein bony changes have occurred, okay, first minimal changes which occur is at the muscular level. So if muscles are changed, then muscular level is affected, then I can go for if only muscular level is affected, then I can go for only exercises. If bony levels changes are have occurred, then I have to go for an orthopedic consultation.
Thank you, ma'am. Next question from Rohit. How pain reduced by physiotherapy?
How?
Pain reduced by physiotherapy.
Last time we discussed, no, electrotherapy can be done. TENS, IOT, ultrasound, SWD, hot moist pad, these all can be given to reduce physiotherapy, to reduce pain.
Okay, ma'am. Thank you, ma'am. Next, now I request Dr. Supriya ma'am for vote of thanks.
Namaste, ma'am.
Namaste.
Good afternoon to all. Myself, Dr. Supriya Bhosle. I would like to thank our guest speaker, Dr. Deepti ma'am, for her enlightening speak on basics of exercise therapy. Ma'am today has enlightened us, beginning with the topic common physical impairments with different clinical conditions, different forms of exercises, how they have to be performed in various patients, what are the factors affecting during the trainings, and different therapeutic exercises based on different systems of the body like endocrine, gynecological conditions, neurological, rheumatological conditions. On behalf of our principal sir and our department staff, I wholeheartedly thank you, ma'am. It was pleasure listening to your lecture after a long time, ma'am.
Thank you.
Nextly, I would like to extend my thanks to our committee members and chairman of our institute and our principals, Dr. K.C. Das sir, for their continuous support in conducting this webinar, Panchajanya 2020. I thank my department staff, other college staff, lastly the participants of the webinar for patience listening and making today's talk harmonious. Thank you one and all. Shall we end the session, ma'am?
Yeah. Thank you. Thank you so much.